While countries around the world continue to implement containment measures in the fight against the coronavirus pandemic, in Mexico, everything appears to be business as usual. For their part, Mexican officials seem confident in the low numbers of confirmed cases, saying the country has been preparing for years, applying the lessons learned from the 2009 outbreak of H1N1, otherwise known as the swine flu. Then, the government ordered a public health emergency that led to a near shutdown of the entire country. But in the end, health officials received praise from the World Health Organization and the U.S. Centers for Disease Control, who called Mexico's response to the outbreak a model for the world. Today, authorities say they're far better prepared than ever before.
There is no need for fear, there's no need for panic, though it is a natural reaction. We need to turn down the fear so that we can face reality and address this epidemic with the appropriate level of public health policies, not more and not less.
People are leaving.
There are others who worry Mexico is underestimating the impact that coronavirus could have, especially in the country's poorest regions.
There is a huge inequality on the access to health services. I mean, usually the middle class and the rich people have access to private systems. Those kind of opportunities do not exist for most of the population. Most of the public hospitals in the country, they are crowded. Long waits, not enough supply of medicines.
While the worst of the now global pandemic has, until now, largely spared countries in Latin America, concerns abound over the level of preparedness in the region. Mexican health officials say they expect more confirmed cases of coronavirus in the coming weeks, but add that the government does not yet feel it necessary to implement containment measures like canceling public events or closing schools. So, are Mexican authorities acting too cool in the face of the coronavirus pandemic? We asked Dr. Alejandro Macias, one of the lead scientists who helped develop public policy during the H1N1 pandemic 10 years ago.
For authorities, it's very difficult to please everyone, because if you do one thing, people ask you why you didn't do more, and when you do more, others say you're exaggerating. It's very difficult for authorities to make a decision that will please everyone.
The number of confirmed cases of coronavirus in Mexico has only recently entered double digits. The government continues to urge citizens to observe basic hygiene as the best prevention against the spread of coronavirus. And most importantly, not to panic. Though panic doesn't appear to be spreading at all. Manuel Rapalo, Al Jazeera, Mexico City.